today is Dr. John Grady Benson, an orthopedician at the Connecticut Joint Replacement Institute at St. Francis Hospital and Medical Center. And we've also got Carol Pagani, a patient of Dr. Grady Benson. Carol had 2 knee replacement surgeries, the most recent in April, and she seems to be doing great today. Welcome to you both.
Thank you.
Thank you.
Dr. Grady Benson, I'd like to start today with asking you, which is most likely the big question on everybody's mind in terms of joint replacement surgery. At what point does it become a necessity?
It becomes a necessity when arthritis becomes so severe that there's pain that markedly interferes with daily living activities. So routine function becomes problematic. Because there's no cure for arthritis, and if anti-inflammatories and other non-surgical options are not doing well, then surgery is the last treatment option and can be a remarkable, life-changing event.
Piggybacking on what Dr. Grady Benson has just said, I did try all the usual things, the medication. I even tried therapy, anything I could do short of surgery, and then it came to a point where there just was no alternative but to have the surgery. And the pain was so that I literally had to get in the car and drive to the end of my driveway to get the paper. That's when you know that you need surgery, and it is truly interfering with your life. You just cannot do your daily activities, and that is what took me to Dr. Grady Benson.
And who are the best candidates for joint replacement?
Well, everyone's different, and everyone's definition of what quality of life impairment is varies from person to person. So some people come to me and say, gee, at the 16th hole of golf, my knees are hurting, I can't go on. And other people like Carol are driving their car to their mailbox. So the bottom line is it's a subjective thing, and it's up to each individual. And it's the individual who really decides when or if they feel truly disabled. Sometimes there's such severe deformity that I would counsel people that if you wait longer, you're going to really impair the ability to have a good result. But that's fairly uncommon. This is a knee replacement actually similar to the one that Carol has in her knee. So the clear thing is actually just representing the bone. But the implant is actually just a metal resurfacing part. So it's a metal cap that covers the femur, the thigh bone, and a metal plate that goes slightly into the tibia or leg bone. The white surface in between there is polyethylene, and that's the standard bearing surface between the metal parts. The kneecap is also there, so it's actually Carol's own kneecap when she touches it, but the undersurface is also a polyethylene bearing. So what's not shown here is probably what's most important, and that is the muscles, soft tissues, and ligaments that make the knee work. So in knee replacement, we're really just resurfacing the joint, and then it's up to the individual to get the leg strong. And that's why for most people, it really is months of physical therapy and walking to regain the strength that they lost over years. And some people are walking and moving well in 2 weeks, and some people take 3 months. But the average person takes 6 months to a year to really feel like the knee is part of them. Hip replacement recovery is dramatically quicker. It's just the nature of the joint. There's not nearly as much physical therapy. It's oftentimes no physical therapy involved. Most hip replacement patients are walking well with a cane within 2 weeks. Most patients are walking well without an ambulatory assist device within a month and resuming a lot of activities by 6 weeks. So the hip just doesn't demand as much in terms of range of motion and stress compared to the knee. And hip replacement satisfaction actually is slightly higher in general than satisfaction after a knee replacement.
So it certainly seems that this type of treatment is on the rise. How many more joint replacements occur today than, say, 10 or 20 years ago?
Well, arthritis has become the leading chronic medical condition in the United States now. So more people are limited in their activities with arthritis compared to diabetes, heart disease, and cancer even. And a lot of its population of the United States, we're all familiar with the term baby boomers, people born between the 1945 and 1965 time period. These days, every 7 seconds someone is turning 50. By 2020, more than 50% of the population will be over age 50. It's not that everybody who ages gets arthritis, but clearly the older population, and we're more active these days than our parents and grandparents were, are more likely to develop arthritic problems. Joint replacement now has known to be extremely effective. The satisfaction rates are extremely high. In fact, satisfaction for hip replacement is really the number one satisfying elective operation of all medical history. That's a pretty powerful statement. So joint replacements work. People who are aging are getting arthritis more commonly, and arthritis is probably becoming more prevalent amongst the population in general. In 2010, it's estimated there will be about 400,000 knee replacements performed in the United States, and probably about 300 to 350,000 hip replacements performed. So it's a huge medical problem. It's definitely on the rise. To care for these patients and provide adequate medical and surgical treatment is going to be a huge healthcare challenge. So one of the reasons that the Connecticut Joint Replacement Institute formed is to have an efficient place that delivers quality, effective care for patients who need joint replacement. So everyone who comes in contact with a patient at the hospital, at the CJRI, knows what's supposed to happen with joint replacement. And we need to do that because it's really our goal to provide effective and concentrated care. And I think that's what Carol experienced too. So.
Oh, I'm very satisfied. I mean, I now can walk to get the paper. And I was able to get rid of my cane pretty quickly. And I think that was, certainly I had the first one done and kind of hung on to the cane a little longer. But the second time I was a little braver and was able to get rid of it. And I still have some weakness in the thigh, which we are working on in physical therapy, but I know the change from when I first started physical therapy to now has been dramatic, absolutely dramatic. And as I told you before, it's this magic number for me, this 2.5 to 3 month window of time that all of a sudden I'm just stronger. I just feel it on a daily basis. So I'm doing quite well.
Great. Just in time for the summer.
Just in time for the summer.
All right.